So I'm going to present this study on contraception among HIV-positive women in France on behalf of France Lert, who is the first author and who couldn't come, unfortunately. So in Europe, in Western Europe countries, ART effectiveness has increased life expectancy. And thus, this has led to a normalization of life expectations that includes sexual life and parental expectations. Family planning, which has been neglected during the early years of AIDS era, is renewed in the era of effective treatment. Actually, in Europe, more than half of new diagnoses are in women of childbearing age, especially in migrant women from sub-Saharan Africa. In such a context, contraception appears to be a major issue for women living with HIV. To date, condom has been shown the most widespread contraceptive method among HIV-positive women, while highly effective methods have remained in a rare use, despite consistent evidence that hormonal contraception and intrauterine device pose no risks to HIV-positive women, whether on ART or not. In Western countries, high rates of unintended pregnancies of women living with HIV and on interventions, high rate of unintended pregnancies have been observed, suggesting an unmet need of contraception. And overall information on the contraceptive profile of women living with HIV and on interventions to increase effective contraception use remains scarce. The objective of the study was to describe the pattern of contraceptive use among women living with HIV in France in 2011. And more specifically, the aims were first to estimate the proportion of women of childbearing age in need of contraception, second to document contraceptive methods, and third to assess the correlates of highly effective contraceptive methods. The study is based on the Vespa2 survey. It's a national representative survey of HIV-positive hospital outpatients in France that allows the generalization of the figures to the French HIV-positive population. And data collection was based on face-to-face questionnaire. Among women of first of all, among women of childbearing age, 56% were migrant women from sub-Saharan Africa, 38% were French native, and 60% other migrant women from diverse countries of birth. And we studied the frequency and the characteristics of women concerned by contraception, and then the correlates of contraceptive methods with a focus of the use of highly effective methods compared to condom. The women concerned by contraception are women in childbearing age, sexually active during the previous 12 months, able to conceive, and neither pregnant nor seeking to become pregnant at time of data collection. And contraceptive methods were divided into three categories: highly effective methods, oral contraceptive pills, intrauterine device, implants, medical sterilization, condoms, and known or only traditional methods. Of the 662 women of childbearing age included in the study, 22% were not sexually active, 15% were pregnant or seeking to become pregnant, and 14% were infertile or menopausal. Thus, 49% were defined as having a need of contraception. We performed the analysis separately for sub-Saharan African women and for other women, since they differed regarding several characteristics. African women were in median 10 years younger than other women. They were more likely to have children. They had been diagnosed for 6 years in median versus 17 years among other women. Most women were in stable partnership with no difference between migrants and others. About 50% were on employment with no difference according country of birth. Material deprivation was both for high group and even higher among African women. Full insurance health coverage was much lower among women from sub-Saharan Africa. And 8 on 10 women had visited a gynecologist in the previous 12 months with no difference between the two groups. When considering the methods of contraception, we found that the distribution of contraception did not differ significantly between women from sub-Saharan Africa and others. About 1 in 5 did not use any contraception or only traditional methods. About 20% of women reported a highly effective method, including 9% in combination with condom. Above all, around 6 on 10 women in both groups reported condom use alone. And among women on contraception, we then compared the use of highly effective methods to condom alone. So here it is. Here are the correlates of highly effective methods compared to condom declared as a contraceptive method, only among women using a contraceptive method. Social and reproductive factors differed between groups. We see that among sub-Saharan African women, the use of highly effective methods was more likely among younger women, less than 30, among those having children and those employed. Associations with other factors were not found to be statistically significant. And among French and other migrant women, the use of highly effective methods was associated with stable partnership and material deprivation. In both groups, medical factors were not associated with the contraception method, and the contraception method used was not associated with health insurance, visit to a gynecologist in the last 12 months period, and no association was observed with being on heart or cardiovascular risk. So, regarding the pattern of contraception use among HIV-positive women, the rate of 20% of sexually active women without any modern contraception is high, and much higher than in the general population in France, which is 9%. To date, condom is reported by HIV-infected women as the most widely used method. It concerns about 75% among women using contraception and with no difference between migration status. However, correlates of highly effective contraception are different among migrant women and among other women. Among migrants, the higher chance of women with children of using highly effective methods suggests that these women are offered the broad range of contraceptive methods by health professionals after delivery. Actually, offering contraception is part of routine professional practices in the postpartum period. The association with employment might be viewed as an acculturation pathway for women participating in the labor market. Among other women, contraceptive method is associated with the type of sexual partnership. Highly effective contraception is less common among women with only occasional partners who have a low sexual activity. In both groups, the use of highly effective methods is not associated with neither health insurance coverage nor gynecologist visit. And so this result shows that the low level of highly effective methods is not related to accessibility, but suggests that physicians, either HIV specialists or gynecologists, might not provide HIV plus women with a full range of contraceptive options. The main strength of the Vespa2 study is that it allows to compute national figures for the whole HIV-positive female population. However, we should acknowledge that we did not document the history of unwanted pregnancies or pregnancies interruptions that could have been useful. And moreover, we missed statistical power to perform a stratified multivariate logistic regression to explain the correlates of contraceptive methods. Our conclusion is that in 2011 we observed that condom has remained the widest used method of contraception in a country like France, where contraception is widely used and accepted. But in the next few years, among people living with HIV, the information of the preventive effect of antiretroviral treatment might decrease the use of condom. Who stated that hormonal contraception is safe in HIV-positive women? It seems that the paradigm of dual protection, that is considering both contraception and prevention of HIV and STI transmission, has not been widely promoted or accepted. We consider that communication and the need for dual protection should target professionals, either HIV specialists and gynecologists, and communication should target HIV-positive women as well. since they might consider they are not allowed to choose the contraceptive method they need. And finally, I would like to acknowledge my co-authors and all those who supported the Vespa2 survey. Thank you.
Would anyone like to come and ask a question?
Excuse me. It appears the microphones on the table aren't working. We'll have each presenter present for 10 minutes, and then we'll provide 5 minutes of questions for each presenter. So this paper is now open for discussion or question. And please let us know who you are and what institution you're with. Thank you.
Laurence Meyer from France, from University of Paris. Annabelle, did you look at the relationship between highly effective contraception use and HIV status in terms of undetectable viral load or treatment?
I'm sorry because I'm not the first author of the paper, and it seems in this analysis it has not been computed, but the best is to verify with France Alert.
Thank you for, is that working? Okay. Yes. For that great presentation, very interesting data. Are you planning to do any work with the care providers to sorry, can you hear me?
Yeah, excuse me, I didn't see you with the light.
So since it does seem like the physicians' attitudes may be driving this, and certainly there have been other data to show that when dealing with HIV-positive people, some care providers assume that they're using condoms consistently and therefore don't need another contraceptive, or maybe think they should be using condoms consistently and shouldn't be offered another contraceptive. Do you plan to do any work with the providers to see whether your hypothesis is true?
Till now, we just had informal discussions with practitioners, and I would say it's between the two of the associations. I mean, providers. It seems that they don't even imagine that women won't use condom. If they are HIV positive, it's obvious they have to use condom, and so they use condom, and so it's not necessary to propose them contraception, and it's really the issue.
Thank you, Mumpati Malani from Botswana. I would like to thank the speaker. The question, you talked of postpartum offering of contraceptives. Did you find any difference on the acceptance of whatever method between the two groups of women, you know, the French and the immigrants? In particular, I'm interested in the hormonal implants and intrauterine devices as compared to the other method. Was there a difference in the uptake? Thank you.
In fact, in France, the huge part of hormonal contraception is pills. And so implants are very, very little part of use. So we didn't analyze implant apart. And EUD, no, it seems we didn't have any difference between the two groups. But again, the majority is pill use.
Can I ask a question, please? I'm here.
Last question.
I'm Dr. Naina, working with WHO Country Office India, working with the PMTCT program. And my question is a little bit added on to what the previous question was, in terms of what was the uptake in terms of a postpartum intrauterine contraceptive device vis-a-vis the oral contraceptive pills, because we know the people are hesitant to be continuing to take oral contraceptive pills regularly, considering that they are with the option B+ in our country. So I was wondering whether you have the statistics towards postpartum IUDs, which is now pretty much very popular in our country, and almost 23, 24 provinces have already started up with the postpartum introduction of IUDs. So my question is, any experiences with the panelists, or if it's coming up later, I could wait for an answer. But if you have an immediate answer, I'd be most grateful to hear from you.
No, in fact, in this survey, we don't really have the data for postpartum because it was a cross-sectional survey, and so we ask women who may have had their children, their child years ago. So it's quite difficult to analyze this data in terms of really postpartum, or you see, it's cross-sectional, but I will transmit to to France Lert, and maybe we can exchange. You can give me your name after, and she can perform the analysis.
Sure, thank you.
A final question at the back.
Thank you very much for the informative presentation. I am Priska Masepuka. I come from Malawi. I work with an NGO called Banjalan Sogolo. It's a senior partner of Money Stops International. In your presentation, you said that you want to accelerate the use of contraceptives and make sure that people get a wide range of choices. I wanted to know in your intervention whether we are going to include the preparation of guidelines and policies on the use of these contraceptives for the providers to use. Thank you.
I'm not sure I understood the question.
I'm asking whether you said you want to strengthen the use of a wider range of contraceptives. Are you intending to develop guidelines and policies to assist implementers implement the...
Okay, in our country?
Yes, in your country.
Yeah, for sure. This is the first analysis, but the idea is to come back to the practitioners and to improve the better proposition of the huge range of methods available to HIV-positive women. And yeah, for sure.